You're listening to Fast Facts Perio Edition. And now, here's your host, Katrina Sanders.
Hello, and welcome to Fast Facts Perio Edition. Hello, and welcome back. And y'all, we are bringing her back by popular demand, the incredible Kristin Evans. You've heard her on previous episodes where we have totally geeked out. She is the pH RDH, and we have talked all things geeking out on saliva, salivary flow, pH, and really how it is a critical marker and driver for the presence of periodontitis. So we got some really great feedback. I wanted to bring her back because we've got some important stuff to talk about. Kristin, welcome back to Fast Facts Perio Edition. It's great to have you.
Thanks. I am so excited to be back talking about spit, right?
Spit happens. Yes. So today we're specifically diving into this new research study, and we'll link it in the show notes below. But this research study actually talks about some of the importance around understanding salivary flow rate and pH. So Kristin, let's dive into this. What's going on in this article that really is something that we need to start focusing on inside of the provision of our periodontal care?
Yeah, so this study is great because it shows that when we do have a decrease in salivary flow, which will be, we know from that, it causes an increase in acid or a decrease in saliva pH. So when we have that decrease of flow in the saliva, we are going to have an increase in perio and an increase in tooth loss. It all goes hand in hand because they are interrelated. And so we have to figure out how to control and help both of those, because again, the leaky mouth, the bacteria is causing the leakage, the thinning of the walls, to have the bacteria go back and forth into our bloodstream, causing the inflammatory response of the body, which then triggers immune response. And many people we know have chronic inflammatory diseases. They do not have an immune system that can support periodontal pathogens like someone that's healthier and younger and has no issues and no medications like we talked about the last episode. So there's things that are driving this, that there are very few patients that would not benefit from having us be very active in our treatment for periodontal disease. And I'm a functional hygienist, like improving their overall health. Like we have to improve overall health and educate. I'm very big on nutritional education. And I think that's key point also, is just helping people understand the oral systemic link. And that is the leaky mouth. And it's very similar to leaky gut, like we talked about in the first episode. So go back to the first episode. We talked about that.
Check them out, y'all. So I love how you unpack this story about perio, because I'll just say, as two women on this episode, and for our women listeners, all people experience this, but women especially, when your pH is off, sometimes things can grow that we don't want to grow. And so we absolutely see this certainly inside of the layers around how periodontal disease show up. We recognize that if our pH shifts, that it will allow for disease producing bacteria to populate more. But even more specifically, when our pH shifts, that acid does kind of burn through that cellular epithelium, which allows the bacteria to enter the body and circulate through the body. So this is, and again, this is not lost on us as dental hygienists. Gosh, we are out there, we're leading the charge. We are in the front of the parade, like, hear ye, this way, it is not lost on me that we talk about this, but I don't think we fully understand the mechanism of how that happens. And so it really is incredible how a decline in pH, so that increase in acid or drop in pH, starts to create this cascade of events. It creates the favorable environment that allows not just decay associated, but perio associated bacteria to thrive. And it allows these bacteria, because of how that acid burns down that cellular epithelium, allows for not only the sequelae of localized perio, but of course, as this research study unpacks, the exacerbation of systemic disease. So what I love about this research study is it actually says that the more that the patient experiences, or the greater the severity of xerostomia in these patients. So the more that we see a drop in saliva, the greater the increase or the severity of perio. Now, I don't know, Kristin, like we knew that, we assumed that, I guess. I mean, it makes sense. Once the data is there, we have to start looking at this differently, because we are an evidence-based profession. Once the data is there and it says to us, it says to dentistry, by the way, when your patients have a higher severity of perio, a contributory factor in that is likely a decline in salivary flow, a drop in that salivary pH. Okay. Now, when we understand that and we're an evidence-based profession, then the next step or the next layer needs to be, so how does that change my care? What functionally do I do differently? I don't know. I was trained in hygiene school to give my patient products that, honestly, between you and I, probably dried them out. You know what I'm saying? Like, I was told to give them medication to dry them out. So,
Yeah.
Okay. So what do we do? How do we take this and functionally apply this to really support how we're actually integrating this into our clinical care?
Okay. So number one is we have to treat the disease. So we have to get in there. We have to talk to our patients about, we've got to control bacteria, because bacteria itself is creating this problem. So it is creating an acidic environment also, and you have a lower saliva flow, or may have in some time in your life, or you may have an immune system compromised, or you may have genetic biomarkers for inflammatory diseases. These are all putting us at high risk. So we have to see our patients and say, this may not apply to you right now, but it could as you age, as you go through hormonal changes, especially women, or you may get, heaven forbid, an autoimmune or a chronic inflammatory disease. So we've got to treat the disease. So SRP, and then bringing our patients back, now I say SRP, but we need to treat it and do it right. That doesn't necessarily always mean that, but we need to treat the patient the way they need to be treated and cared for. I always say, treat them like you treat your mom. Like, if you want to do the best care for your mom, you better do it for your patient. So that's always been my philosophy. Treat them like they're your family. Mm-hmm. And so then recare. Recare is the only evidence base is 3 months, 90 days. 90 days shows evidence of bacteria being able to be controlled. And that if we can control the bacteria, then we're going to help control that acidity. We're going to keep it from growing. We're hoping those healthy bacteria are going to come in. We can do that by supporting a balanced, great diet. Again, I'm a functional hygienist who studies and loves functional nutrition. That's my second love. So I dive deep into that. As we can do educational counseling on nutrition. We can actually bill for it. So if you're not looking into that, it's got to be done. And it's in our scope of practice. We have all the ability to do it, start learning, listen to programs, and get excited about it. So we've got to help our patients get to maybe even their own nutritional counselor, get them referred to a primary care physician when we see that their blood, if you're taking blood pressure and it's high, if you're doing A1Cs, I ask about the A1Cs of my patients. It's so keeping up with those screenings. I think we're going to start seeing a lot more medical screenings in the dental as we start to see a decline in our primary care physicians. And they're going to say, hey, we can have a hygienist do it. And she's great because they see them twice a year or 3 times a year or 4 times a year. So it's keeping your patient on that. And then, so the recare, again, 3 months is to save people's possibly lives and their oral health and their teeth. And this is going to be great. It's going to keep their immune system really functioning well. And then what we hope, with the help of their primary care and all the other things, we're hoping to add, we can only do what we can do, and we can do a lot. We can help them. And then artificial salivas. I mean, there's things in there that help to, I wouldn't say like necessarily completely artificial salivas, but you can increase saliva flow. So xylitols. Some people even do like I always say this word wrong. Pilocarpine. Yeah. And sometimes if someone's really severe, compounding pharmacies will do a sucker so that they can do that. Those are great. The rinses, the gums, the things like that. Just be careful that some of the rinses on the market are pH acidic. And so you've got to have those pH neutral rinses and make sure you can pH test them, have your patients test them. If they come out acidic, then don't use it for sure. No alcohol products. And those are really, really big. Again, soda dehydrates, that's number one for a lot of people. Tobacco, caffeine, alcohol. Those are things that we can keep our patients avoid. And then just a balanced diet, good eating, exercise, sleep. I'm into all three of those.
That's amazing. It was interesting as you were talking, you had mentioned our primary care physicians, and we are seeing this kind of new generation of people not really having a primary care physician unless there's a big problem or there's something wrong. And we're actually seeing it across the board in our, high socioeconomic status, educated population. It's like, once you get off of mom and dad's insurance, you're like, well, I don't really need, what do I need to see a doctor for? Women go in for their women's annual exam to like make sure everything's all right and all the things, but most of us don't see a primary care physician routinely. And even still, if we did, the data right now actually tells us the average primary care physician has about 9 minutes and 36 seconds. That was a new data point that was kicked out a few years back. That's how much time a PCP has to do an exam. And what are they doing? I mean, with all due respect to our PCPs, they're, hey, are you sleeping okay? You eating okay? How's your libido? Are you pooping okay? Those are the things they're asking. And then from those screening questions, surmising an opinion of the patient, they send them on their way. Now, with the use of, and you mentioned it in a previous episode together, one drop of saliva can give us an incredible amount of data. It can tell us about pH levels. It can tell us about the microbiota. It could, now we're starting to see salivary diagnostics being able to help screen for cancer risk, HPV risk, glucose concentrations, diabetes screening. So dental hygienists and the amount of time we have, the preventive specialty training that we have, and the incredible data we can distill down from a drop of saliva is really positioning us to step in as a far more, in my opinion, integrative provider from a more non-invasive approach. I laugh. My fiance gets very googly about IVs and arms. I got phlebotomy certified when we first started dating so that I could do blood draws for PRP and PRF in our office. So, and he's like very muscular. So he's got those like juicy, veiny arms, and I remember I was like, oh my gosh, I just want to stick a needle in that arm. I mean, it's like, it looks so good if you're phlebotomy certified, but but it can be invasive. Taking a drop of saliva is non-invasive.
So easy. Yeah.
Do we see just such an incredible, there is such a future inside of understanding saliva, how saliva can really impact our patients' overall health, their oral health, not just from a decay standpoint. And now saliva could give us a very big missing piece to the puzzle in helping to identify other potential underlying conditions. So thank you, Kristin, for your curiosity, your support, the things you're doing to unpack this conversation. Y'all, please connect with Kristin. We'll put all of her contact information in the show notes below. Thank you for sharing your knowledge with us. And thank you for geeking out with us here on Fast Facts.
For sure. We want to be the healthcare providers of the future. And it's coming, girls and guys.
That's right.
I mean, hygienists, we are going to be it. And let's stand up and be proud and do it.
I love it. I love it. Oh, thank you so much. From Kristin Evans, the RDH. This has been another episode of Fast Facts, Perio edition with Katrina Sanders. Please feel free to reach me on Instagram at The Dental Wine Genist or on my website, www.katrinasanders.com. Cheers.